So let's take our next question. Our next question is 30 years old female was brought to the emergency room after fire accident. On examination, she had circumferential full thickness and a deep partial thickness burn involving lower limb. Now the procedure has been shown in this image was performed to relieve the vascular compromise. You have to identify the procedure. Okay, so your option is escharotomy, option B is debridement, option C is the excision of healthy tissue, fat or fascia, and option D is the early skin grafting. Okay, so in this image you can easily able to understand is that there is a longitudinal skin incision that has been given here, right? Longitudinal skin incision. Okay, now let's try to understand this clinical scenario first. Okay, so in this question they have already given us the clue regarding there is a full thickness burn which is also known as a third degree burn, right? And there is a deep partial thickness burn also known as the second degree burn. So this third degree and the second degree burn will eventually result to form an eschar. Now you have to understand what is the eschar. So your eschar is basically a dead tissue that basically forming an appearance of leathery, thick and inelastic consistency. Okay, so it basically takes thick, leathery and inelastic consistency, that is your eschar. Now what happens during the burn, in some cases there is a burn that basically involves either there is a limb or sometimes chest or abdomen, they will eventually seen in the circumferential manner. Okay, so obviously this eschar that will also going to form in a circumferential manner. Now as I have already mentioned, this eschar is basically inelastic, right? So as a result of that, it will basically form a tight band around whatever the area it basically involves. So in this case, there is involvement of the lower limb, right? So obviously this eschar basically forming a tight band around the lower limb. As a result of that, what will happen? So as a result of that, there is a increased intercompartmental pressure. So this intercompartment pressure raised leads to formation of vascular compromise. So initially the patient will eventually seen with a decreased limb perfusion. So there is a cold, pale and the pulseless limb. So this pulselessness is going to be the last a clinical presentation in such cases before the patient going to develop ischemia, okay, and eventually loses the limb in that case. So obviously you guys can able to understand. So it's a their emergency situation. So we have to act fast during this kind of problem. Now what we do in such cases, we have to go for the escharotomy. Okay, so these escharotomies are the one which is a life saving and also limb salvage procedure in this case, in particular case scenario. So this escharotomy, we try to incise the skin and including that dead tissue as well. And this longitudinal incision typically extended deep to subcutaneous tissue, deep to deep fascia as well. So we have to release the deep fascia as well. So as a result of that, there is a relieving of the pressure and there is a restoration of the perfusion. So that will eventually prevent the compartment syndrome if we can take the necessary step in the correct time. Okay. Now, look, this kind of procedures are eventually done on the bedside. So, because of the nature, of the emergency in such cases, so they are eventually done on the bedside. Now, we have to understand if you can arrange an Doppler a machine or something like that, obviously it would be going to very much helpful for you because you can easily can demonstrate the capillary refill while doing the procedure and after successful completion of the procedure. So this is your escharotomy for you. Okay. Now let's try to look into the incorrect option. So your incorrect option number 1 is a debridement. So debridement means nothing. We just try to remove the all dead tissue. So this debridement usually done in case of infection. So there is an infection in the skin or subcutaneous tissue. There is a lots of dead tissue. Now these dead tissues are going to work for the needles for the infection. So for that case, we have to remove all the dead necrotic tissue in that case. So this is your debridement vein for you. Then obviously there is a excision to healthy tissue. So this excision to healthy tissue is typically done for the surgical preparation for the grafting. Okay, so it's not at all it's not at all done for the vascular emergency. And then there is a early skin grafting like the post excision tissue healing, which is not for the emergent pressure relief. Okay, so obviously from this discussion we are easily able to conclude that our option A, Escharotomy, is going to be the answer, right?